Hello, everyone. My name is McFrances George, also known as Doctor, Nurse, Tutor. I have over 15 years experience as a registered nurse in bedside nursing. I also have 6 years experience as a family nurse practitioner in primary care. I hold a postmaster's certificate in online education, which focuses on higher learning, and I also have a PhD in nursing education. I'm coming to you all today because I want to present the opportunity to provide tutoring services on this streaming platform to any students who may be struggling with either not taking their certification exam or having taken the certification exam more than once and not passing. Certification exams meaning the NCLEX as well as the AANP, because that is where my specialty lies. Now, tutoring services, though I know there are many, my approach is a little bit different because my learning is a little bit different, and it actually took me realizing that I learn very different from how other students or other people may learn and how they process information when it comes to certification exams. I realized that I am not only a auditory learner, I am a visual learner. And what does that mean? Just hearing information is not enough for me to process, to understand, to sit down and break questions down in order to find the answer. I'm also a visual learner. I need to be able to see what it is you're talking about, visualize it in my mind, and how to then process to even break down what the question is asking to find the answer to the questions. And once I realized that, I had a much better time with sitting down for certification exams and passing these exams. And I have taken the NCLEX. I've also become certified as a med-surg registered nurse. I took the AANP, and once I was able to understand how the test taking strategies benefited me, I did a much better job at answering these questions. Now, how is my approach with tutoring? My approach with tutoring is I take the question. I am not that tutor who cares about how many questions you've answered correctly or how many questions you've answered incorrectly. I am the tutor who wants to know, why did you choose that answer? What was your reasoning? What was your rationale for choosing that answer? And why are the other answers incorrect? Not only are you going to have to tell me why the answer is correct, but you're also going to have to explain to me why the other answers are incorrect. The reason for that is NCLEX practice questions, though they are beneficial, they may not be presented to you that way in the NCLEX or even in the AANP. They can take one question and flip that question 15 different ways to try to trip you up. So if you don't understand the rationale behind why something is the answer to a question, when that question is presented to you differently in the NCLEX exam, you're not going to be able to choose the best right answer. So we're going to sit down, we're going to break down these questions so that you have a better understanding as to why this is the answer. What I'm going to do is I am going to present NCLEX style questions, review questions on this platform, and I'm going to do it in like a PowerPoint presentation where you'll also see me down at the bottom of the screen reading through the questions as well as the answers with you. It's going to be anywhere between 5 to 7 questions because I really want to delve into the questions, break down the questions, explain to you what the questions are asking as well as what the answers are asking. And then once we come to the best choice, then we're going to read through the rationale so we get a full understanding of what the whole picture is that the questions are asking us. Why is that important? Because as nurses, we have to know how to prioritize. We have to know with the patients that we're presented in front of, who's the patient that's going to be your top priority, who is your patient that's probably going to need minimal of your time. Top priority meaning these are patients who have issues with their ABCs, airway, breathing, and circulation. These are patients who may crash on you very soon. These are patients who situations or reason for coming into the hospital could probably take a turn for the worse if that's not a patient that you make a top priority of yours. So by me saying airway, breathing, and circulation, as nurses, we're already supposed to know anything that compromises a patient's airway, breathing, or circulation should take top priority. Those are the kind of things that the NCLEX wants to know, that you have familiarized yourself with and that you can identify. Because if that is not something that you can identify with, you can almost guarantee that you're not going to pass any of these certification exams. So that's what we're pretty much going to be doing. Like I said, I'm going to be presenting at least anywhere between 5 to 7 questions that I can squeeze in to give you a full breakdown as to how to answer these questions. I will be doing this maybe 1 to 2 times a week, but for the students who would like one-to-one tutoring with me, that is also an option. If you would, I will have my email address linked below this video. You can send me an email and we can further discuss in details how we can go about providing you with one-to-one tutoring services with me, which will probably be on like a Zoom platform, so that we're doing this face-to-face and we are reading questions together, we're understanding questions together, and we're understanding the rationalization for the questions that you are being presented with. So with that being said, welcome to my channel. I will have more videos posted for you. I just wanted to come and give a little introduction, give you some information about myself, where my expertise lies, as well as my experience in nursing practice and in nursing education. So look forward to more videos coming your way. If you enjoyed the videos, please like and subscribe to my channel so that I can present you guys with more videos on different questions, different topics, different body systems. All right, look forward to seeing you guys soon and look out for videos. Bye-bye.